not to for a living.
Uh-huh.
Okay. The mission statement?
Our mission is to anticipate and provide services to meet the healthcare needs of the people we serve.
Thank you. Presidents, welcome. Welcome, everyone. Approval of minutes. Does anyone have any additions or corrections to the minutes in May?
Oh, I didn't read through them, I read through the financials.
Oh,
Are they in here?
you have minutes.
Oh, here we are. I make a motion to approve the.
Okay, we have a motion on the floor. Do I have a second?
Second.
Okay, a motion to second. Roll call.
Graig.
Yes.
Maggie.
Yes.
Rosemary.
Yes.
Yes.
Okay. Members of the public are welcome to participate in the meetings of the board. Comments of the public will be accepted during the public comment portion of the agenda. No action or comments will be taken by the board on matters not on the agenda. When the board president recognizes a member of the public for oral comment, such comments shall be for 3 minutes or less at the discretion of the board president. We would like calm presentations so that the importance of what you are presenting is not overshadowed by the manner of the presentation. Any public comment? If not, we'll move on to the treasurer's report.
Okay. So this is as of September 30th. So this is for 3 months. You can look on page 6. We're still lagging a little bit behind in our cash, but it's just the collection of some revenues from Eden Valley that we hadn't caught up on as far as of September 30th. You can look on that first column, the third line down, you can see our patient accounts receivable at $2,000,004. That's almost $921,000 higher than last year. Last year we just had it in cash rather than in receivables. So, but you'll notice that one thing we like to see is our total current assets, which is that $4,533,000, and we compare that to our current liabilities, which is $3,663,000. So we're about $900,000 to the positive. You know, that for most banks and other lending institutions, it has to be minimum of 1-to-1. You have to be able to cover your current liabilities with your current assets. But they like to see 1.5 to 1. So we're getting up there. We're not quite there yet, but we're getting closer.
Good.
Okay.
Good.
And our number of days of cash on hand, we're finally into the 40s. Okay. You know, we were last year. We were at 80, and I think once we get that cash back into our reserves rather than in receivables, you know, once we get the payment, we'll be back up to where we were.
Well, and that 80 included the line of credit money, didn't it?
Yeah.
Yeah.
Yeah. So hopefully, you know, when we get the money and everything is, you know, we continue to do as well as we've been doing, that number will shoot up because we really want that to be a lot higher than our 90 days that we're typically at. Okay. On page 7, you can see our operations. So about middle of the page where it says operating income loss before depreciation, $781,000. Look at that compared to the prior year. So our prior year, you know, the first 3 months were our worst 3 months of the year. The July, August, and September. And then we started making improvements and started to climb to get back to break even by the end of the year. This year, though, you know, we're $1.4 million ahead of where we were last year at this point. So as long as we can continue on the course that we're on right now, everything looks really good.
Yeah.
Okay. We even have enough to cover the $1.2 million of the PPS settlement that typically happens at the end.
It's
of the year.
getting close to cover it.
For this year, I mean, if you figure 1.2 million is 100,000 a month, you know,
Well, that's true.
so our liability would be 300,000, and we're at, you know, after depreciation, we're at 600 some odd thousand of income. So we're really at 300,000 of income. We're still positive even with the PPS accrual. Okay. You can see a summary of income by operation. Eden Valley is 540. Clinic is at 284, and then the district, which basically just has expenditures until our property tax revenues come in, is at a negative 212.
Can I ask you a dumb question? But it's the IDA. And I've asked this before, and you probably answered it, and don't get old. We were going to increase our fees a little bit at a time each year, so we don't have big increase.
Oh.
So have we done that yet, or are we going to do that soon?
Are you talking about Eden Valley?
Yeah.
I'll put that in my report, so yes.
Okay,
Yeah.
good, okay,
I'll give you guys all that information.
okay,
Yeah.
sorry.
No worries.
So anyways, for the first 3 months, we're at 612,000, that decrease in net assets, averaging about 200,000 a month. It's really, really good. Okay, we go to page 8, you can see where our cash is. The majority of it's at First Capital Bank. Accounts receivable, once again, the majority of it is for Eden Valley, and the majority of it is either Medi-Cal or Medicare. Okay. Summary of income by month, there you can see the average of 200,000 per month, 164 in July, 242 in August, 207 in September.
Huge.
Okay? And our gross revenues by type, you can look at, we used to say Medicare needed to be about 50% to break even, but when you have all the beds full, we're not quite at 50%, we're at 41, but, in prior year, I went back and looked, we were at like 29% for Medicare.
Are we
So
full at Eden Valley?
46. We'll talk about that census is low in all the hospitals right now.
Okay, so then on page 9, you can see Eden Valley by itself for the 3 months. You can see the 540,000, it's by department at the top and then by expenditure type down below. So the only real fluctuations that really draw your attention, you look at nursing administration on the upper section. You have 411,000 versus 103 the year before. So that's an increase of 308,000, and that's due to our agency nursing. Okay? And then down below, you can see that same increase in professional fees. That's where your agency fees are coded as far as by expenditure type. So it's the same type, it's the same area.
And those are decreasing every month.
Oh, they are.
Mm-hmm.
Okay? Let's see, then you go to page 10, you can see the clinic. And once again, look at the professional fees. They're down 203,000.
Yeah.
That's because we don't have the agency,
Yeah, huge.
okay, this year that we had last year at this time. Okay? But that's, and then the other big revenue item here is our contractual adjustments. Our contractual adjustments are way down from the prior year. Because our revenues are actually lower than last year at this point for the 3 months, but our contractual adjustments are down by, 600,000 from the prior year. So that's where the difference is. Okay? All right, and then, so you can see just for the month of September, Eden Valley made 224, the clinic 104, the district had 80,000 of expenditures, and then depreciation 41,000 to get us to our 206,000. And then when we review the budget, you can see how both Eden Valley and the clinic are absorbing those costs of the district and still making a profit.
Well, how come the clinic was so much less than last year, or no, July and August?
No, so this is just for these 3 months. So you have July and August, those are the first 2 months, then you have
And then
September.
you add them. and
Then
get
you
your total.
add them to see what we're doing for the year. This isn't a year-to-year comparison.
Okay.
This is just for the 3 months. Okay? And then on page 11, you just see the summary of cash flows, where our cash has gone. You can see on that second to last line, you can see where we paid off the line of credit. I think that was in either August or September that we paid off the line of credit. But you can also see the increase in accounts receivable is one of the reasons why we have less cash. 368,000 right there. Okay? All right, so that's the report, and then we look at the budget to actual. This is the budget review. And so what we have here in the first column is the budget year to date. So if we look at our budget and say, okay, for 3 months, this is what we should be doing. And for 3 months, our budget called for a profit of 25,000, bottom line there on page 12. And our actual for the first 3 months is a profit of 612,000. So
Wow.
much better. So even in comparison to our budget, our budget is pretty much a break even every month. That's how we budgeted it. So anytime we make money, it's going to look really good on this budget to actual. Okay? So,
You know what, one question. Under operating expenses,
uh-huh.
so we're over budgeted, right?
Yes. We have spent, what is that, about 150,000 more than what we budgeted.
Okay.
And some of that could just be timing, where we budget, last year we spend, 900,000 for the whole year, and we divide that by 12 and say, okay, this is where it's gonna be. But for like vaccines, we may hit all our vaccines, or at least 50% of our vaccines in 1 month, and that may hurt us in that 1 month, but it may catch up in the long run.
Got it, yeah.
But some of
We'll see
this,
it even out probably as the
we
months go
will
on.
see some of it even out, but some of it, because of the agency and those kind of things, some of it is where we're over budget.
So then, if my memory serves, as we get down the months, we can make changes, quote, to the budget so that it will match the actual, right?
We can do mid-year budgets.
Yeah.
Those
And
type
then
of
that
things.
way it'll balance it out, because if we spend more in utilities versus insurance, we can flip those. Okay, good, okay.
Yeah, so like looking at professional fees, that one probably may not even out, because we know we have spent more in agency professional fees for the nursing than what we had
But then we can
anticipated.
change the.
But we can't change it.
Just maybe from salaries to professional.
Correct. Yeah, because we are under there by 200,000
Yeah, right.
because of the same issue.
And some of those things happen over time, that you just have to have that.
Yeah.
Okay.
Okay. But if you look at the middle of this page, and this is just under general and administrative, so you can see that we had, over in that far right column, under operational expenditures, you can see the district had 326,000 of district expenditures. Okay, that's for administrative staff, that's for the plant and operations, salaries, those type of expenditures. And what we do on this line at the middle of the page, allocation of district expenditures, we allocate 60% to Eden Valley and 40% to the clinic. And we do a 60-40 because that's based on salaries. Because typically our salaries are 60% allocated to Eden Valley and 40% to the clinic. Okay, so that's how we allocate those expenditures. So after that, even taking that into consideration, Eden Valley, after absorbing 60% of the district expenditures, is making $344,000. Clinic is making $154,000 after interest. And the district has $113,000 of revenues, and that's primarily the refund on the generator. Okay, so that's what's in those refunds. Okay, and then on page 13, 14, 15, it's the budget actual just for Eden Valley, so you can see Eden Valley's budget actual. Once again, look at the professional fees. That's the only thing that really stands out on that whole page. Other than your revenues are up by 338,000, but the only other thing that stands out is the professional fees, which is the agency nursing. Then on page 14, you see the clinic. Your expenditures are all pretty much in line. When you look at 2.6 million of professional fees and you're only off 76,000, that's not bad. But there, your main difference is in your contractual adjustments and revenues. So, and then on the last page, on page 15, is the district expenditures. So the 3 months budget here today is 344. We spent 326, so we're under budget for our district expenditures by 18,000. Okay. Any questions?
Any questions?
Just another good month.
Yeah.
Congratulations.
Thank you. You've been working really hard. You really have.
Need a motion to approve the treasurer's report?
I'll make a motion.
Leanne's got a motion, do I have a second?
I'll second.
Okay, Maggie seconds. Roll call?
Graig,
Yes.
Maggie, Rosemary,
Yes.
and Ann.
Now we're going to, we got the bunch, we'll take action on the monthly budget review. Anyway, we have a motion to approve the monthly budget review that Frank just went through.
I'll make a motion.
Okay, that's motion on the floor, do we have second?
Second.
Okay, Rosemary seconds. Roll call?
Graig.
Yes?
Maggie.
Yes.
Rosemary.
Yes.
And Ann.
Okay. The next item is the meeting calendar, and that is on page 16.
I'll make a motion.
Make a motion to approve.
I second.
Okay, motion to approve and second. Roll call?
Graig.
Yes?
Maggie.
Yes.
Rosemary.
Yes.
And Ann.
Okay.
Can I just ask a real quick question?
Sure.
So what is the meeting schedule for the rest of this year? What is our meeting for November? What day is it?
16, and that's it, and we're done.
The 16th?
Uh-huh.
Okay, that's gonna be really hard to get the board report done by that date.
Because the other week is Thanksgiving.
Is it
Yeah,
the
but-
16th or the following?
It's the 16th, because the following is Thanksgiving.
Oh,
But typically I've been getting the,
oh, yeah.
The revenues. and I get the payroll done about the 7th or 8th, right after the payroll is processed. So you're gonna need this by that Friday, right? The 10th?
Oh,
And
yeah.
I get the payroll on the 8th, and then I get the revenues usually on the 12th.
Yeah,
And-
Mission Impossible.
And they extended the due date for all the tax returns to
Oh,
November
yeah.
16th.
Changed it again.
And I still have 50 people that are scrabbling that are still want their returns done. I don't know if I'm gonna be able to meet the 16th deadline. That's a little early in the month, but
It is what it is.
I can try, but I'm
Yeah.
just
And then I'll
not
work
sure I
with
can
staff.
promise that.
I'll work with staff to get you your reports on time.
Okay,
Yeah,
all right. I'll do my very best, but
thank you.
Well, yeah, we don't expect the impossible.
Yeah.
Okay,
okay. Am I excused?
well, you're excused.
Yes,
Thank you very much.
Great, thank you.
Communications coordinator item?
So, great news, we've hired a new communications coordinator, and she will be coming on board. So, just to report, this is Breast Cancer Awareness Month, if you weren't aware of that. We did do a nice presentation in the newspaper, the King City and Salinas Valley Tribune. If you haven't had a chance to look at it, but it was just a article that we did there outlining our mammography machine and, letting women know and people know in that community that we have this service available at the Women's Center to have a mammography. So, so good things are happening, and this is important because, as you guys know, it's prevention and cancer awareness. The city did reach out. They actually want to do a proclamation for breast cancer awareness, and they reached out to us potentially to go to the city council and receive that proclamation for the services that we provide. So that was in this week's paper. Other great news is that we've now hired our new communications coordinator. Her name is Adriana Gonzalez. She will be starting November 20th. She is joining us with several years of experience in social media, marketing research, event planning, project management, media writing, public speaking, and graphic design. She holds a BS in public relations from San Jose State University. She's participated in recent district rebranding efforts and played a role in organizing our events at the 75th anniversary. She actually was at the door at the Historical Society greeting people. Yes, so she has worked along our side for a while. And that's all I have under communications coordinator. Any questions?
Any questions? Okay, district CEO report.
Can you send Natasha a note for me? All right, so I hope everyone's enjoying their fall weather. This is the month homecoming at the Soledad High School. We've seen the parades going by last week.
Oh, really?
Yeah. Next week is Halloween, and in front of you are some treats to help kick off the holiday season. Shortly around the corner, the remaining holidays of the year, believe it or not. We plan to have both an employee Thanksgiving event staff appreciation event. I'd like to invite you to our employee Thanksgiving luncheon on November 14th from 11 to 2, and it will be in our garden. News that's happening within our community right now. Salinas Valley Health Pete Delgado announced his resignation, and his last day will be June 30th, 2020.
Now, who's this?
Pete
The
Delgado.
CEO of Salinas Valley Health, Pete Delgado. There's no other further information except for that. There was an article in the newspaper, and it also came out in our ACHD newsletter that happened as well. If you guys recall, ACHD, we talked about the minimum wage and that it would increase starting in 2024. It was SB 525. That did pass. This is a newsletter from ACHD. You can get it online as well. And what it indicates is the tiers and the levels. So tier 1 would be for anyone who has covered employees of more than 10,000, covered employers with 10,000 or more full-time employees. And then it goes through the levels. Tier 2 is primary rural health and community clinics are specified in the bill. So that's probably where we'll fall. So beginning in 2024, and we have up to 2026 to do an increase in salaries. And then so forth, and it goes to 26, and then it goes to 27.
So what is it right now?
18.
15, no, it's $15.50. Federal is $15.50, and it's going to go up to $16 next year. So that's where it's at. We plan for 18. We'll have to plan for additional dollars because it's going to go to 21.
So some are going to go from 16 to 21?
Yeah. So I'll show you guys those projections, and maybe we'll have to make a mid-year adjustment. It'll be pretty significant.
Yeah.
And then the last tier, we're not a hospital, but that's another tier that we should also be aware of. So this is what I talked about last month. These are the considerations that need to happen. Any questions on that? Okay. MC Gibbs,
Wait, how many employees do we have?
150, around 150.
How many?
150.
That's where we fall in tier 2. Tier 1 is what
MC Gibbs, you guys should all have received a constant contact email inviting you to participate, to donate to the foundation. This year we are doing it with the focus of the CPSP, our Comprehensive Prenatal Education Program. Last year we raised over $6,000, and that this year our goal is to raise what we need for this program. The donation, and we appreciate any donations that you may give, starts November 9th and it runs through December 31st. We also will be sending out, for those that don't have electronic methods, we'll be sending out it in the mail as well. We've already received over $2,000 in donations from our foundation members as well, because we needed at least $500 to get in the campaign, and we had 2 of our foundation members who donated $5,000 for MC Gibbs as well. Finance, so we talked about Medi-Cal Alliance for Aging, and we got a grant from them, and in the tune of $234,000, and we received payments in 3 installments. The last and final installment will be this October for $23,424. And if you guys recall, that was financial investment, providing financial investment to practices to make quality improvements in interventions, to improve our quality improvement scores.
And that's for Eden Valley.
That's for the clinic.
Oh, for the clinic. Oh, okay.
So just to give you an idea of where we stand, so as of this is a report from October 1st of last year through September of this year. We met 6 out of the 18 quality measures, which means what the only ones we need to improve is BMI, child and adolescents, and wild child visits in the first 15 months of life. Quarterly quarterly child and adolescents. For June 2023 CBI meeting, we received 55.5, which was an increase from quarter one. So each quarter we're increasing. So we're doing really well with that. Obviously, we still have some areas of improvement, which the team is actively making an effort to get done. So BMI would be the improvement for child and adolescents, and the well child. If you guys remember, we have to have at least 6 visits in 15 months. They've now increased it. In 30 months, we have to have 8 visits of a child. And we're not the only one that struggles with this. I had a meeting with the county that we're all in the same challenge there. So we're doing well there.
So in 12 months, 8 visits.
No, 15 months,
Oh,
6 visits, 30 months, 8 visits.
Okay.
So that is, we're still doing well, we're still doing improvements, and we still have plans in place to improve on that. What else? Capital improvements, we're still continuing with our computer upgrades. As I explained last time, our goal is we have about 40 computers that are 5 to 10 years old, that we initiated a plan to replace 5 each quarter, which we've done, so that we don't overwhelm or burden our costs. The foundation Gift of Light request this year is focused on replacement of the beds for the residents. So that's another program that we have. Do you have the Gift of Light? Do we take that back? It's okay. I just wanted to show you guys a Gift of Light. I think we took it back. Letter that the foundation just approved. It's really beautiful. It's going to go out in the mail, so look out for that. And that's a
I
donation.
think it was under there.
I think I took it.
Under there. No?
No. Yeah. It'll be coming in the mail to you, and every donation that you give to the foundation will go towards replacement of beds for residents at Eden Valley. Audit. So we have had our audit. Our audit is well on its way. The team is currently gathering all, collecting the list of documents needed, and we are engaged with the auditor that we've had in the past, and we should expect to have a report by them by early next year. A lot of work that goes into that. And Eden Valley, good timing, Natasha. Natasha is here to give us our Eden Valley report.
Hello, everyone. Hi. I'll start with staffing for September. We had 2 new hires. We had our DSD, our Director of Staff Development. Actually, it's 1 new hire, but she's doing dual roles. So she's going to be our DSD and our IP nurse. So she's doing both positions. We still need 2 full-time LVNs to be fully staffed. 4 to 5 full-time CNAs needed to be fully staffed. We continue to utilize registry to fill most of our positions. However, you should see a huge decline in October. We've reduced
decline in what?
in October in this month.
Oh,
So we've
October.
reduced the amount of agency staff that we've been utilizing drastically. Department head openings, we still are in need of a full-time permanent DON, Director of Nursing, a full-time activity director, and our full-time social service director.
Full-time what?
Social service director.
I didn't get that.
Social services?
Did you
Special
take
services.
your
Social
last
worker.
one?
Yes,
Yeah.
Yeah, thank you.
you're welcome. A social service director, social service worker, we still need a full-time. And we have just hired a MDS coordinator who is starting on November 1st. In the same month, we lost our DSD and our infection preventionist. So we have since replaced. Census, we had 27.9% Medicare, 7% HMO, and we ended at 93% total occupancy.
And this is for?
This is for September.
September?
Yes, September.
Wow, that's good.
Yes, not so good for October though.
Oh!
So we did take a big hit this month. Unfortunately, it was primarily due to our two biggest feeders, our hospital feeders, Natividad and SBMH. Both are extremely low right now. I called Natividad this morning, spoke with the case manager director there. They're in the 130s, and they're a 172-bed facility.
So they have low occupancy,
Yes.
which flows down to us.
Absolutely, absolutely. With that, most of their patients are either going home or have psychiatric needs. So that's the reason why they're not referring at the moment to us.
So where do they go for psychiatric needs?
I don't know. I'm not sure where they go to, maybe to a lock facility. Sometimes it's outpatient services, but they're going from the hospital. SBMH is a 263-bed facility, and right now their census is also in the 130s. They have 14 plus patients in observation. So that's why we're taking a big hit at the moment. Yeah.
So what's our occupancy right now?
We are 46 today. 46. And I keep saying I
That's
don't
not
like.
bad.
Oh, it's bad for me. That is bad for me.
So she's a high achiever.
It's the lowest it's been since I've been here.
You've done an
So,
outstanding job though, so thank you, thank you.
well, you're welcome. I'm hoping to keep it that way. So,
There's conditions you can't control.
I know. I'm trying not to stress so much over it. In September, I'm not sure if I already covered this, our Med-Aid reimbursement was $364K, and that's a decrease of $59K from the prior month. Our total revenue was $829, and that's also a decrease of $84 from the prior month. Referral sources for September have been from SBMH. We had 20 admissions, come from SBMH. 3 come from Natividad, 1 admission from CHOMP,
Okay.
and 1 admission from Good Samaritan, and they're located in San Jose. So overall, we had 25 admissions. Events, we had a salsa eating contest. And as always, every Friday, we have scavenger hunt Fridays. And that's it for my report. Any questions for me?
Salsa eating or salsa dancing?
You know, a little bit of both. I think they had a little bit of both going on.
Who won that?
I don't remember who won. Sophie, do you remember?
It was Myra.
Myra.
Myra, she won one of the prizes. Veronica won another one of the prizes. We
There
gave
was
several.
more,
There were several ones that we gave out. Yeah.
Okay.
Nice, that sounds like fun.
Yeah, it was.
So I have 2 questions.
Yes, ma'am.
The all-time wait list,
Yes.
okay?
So, our front office staff was calling some of the residents that were on that list today. And there were only 2 residents that were still interested in coming to our facility.
Okay.
So I've instructed Haley on what to do and what they need to do from this point on to come in.
Starting tomorrow, there's only 2 people on the wait list.
2 people that are still interested, correct?
What are
Yes.
the other people that were on the list?
I'll tell you. So if I may.
Oh, absolutely.
Yeah, so there's a total of 23 that were on the list for over a year, of which 13 came from home. 5 we didn't know where they came from. One was from Mercy Hospital, one was from Coprolus, one was from a group home, one was with Phyllis, and one was with Windsor. Out of the 23, we admitted 48% of those already. So we're doing a great job.
But what's, if it was 23 and you admitted 48?
48%.
Huh?
48%.
Right,
So
but my
11
point is, if there was 23 on the list and you admitted 48%, wouldn't it drop it down to 12 or 13?
Yep, we have 12, and out of those 12, Natasha just mentioned to you, we only have 2 viable interested. So we really don't have a waiting list anymore because we've expanded our facilities need. So really, the waiting list is not necessary anymore. Yeah, so if,
You know, I want to keep this in the back of your mind. I have a relative who's getting out of the hospital at the first part of November,
Okay.
and hopefully, she's in CHOMP. And so hopefully she can get in here.
Oh, absolutely. As long as we have a bed available, it's hers.
and we can meet their healthcare needs, right?
Well, that's the big thing.
That's
Yeah,
it.
we have to be able to
This
meet
is,
their healthcare needs.
that's
Uh,
serious.
The other thing is the new medical director,
Yes,
working out okay?
I think so. I haven't heard any major complaints.
And we still have 2 on board? We still have
We
both?
still have both Dr. Pham and Dr. Beltran, yes.
All right,
Any
that's the
more
only question I
questions?
have. Thank you.
very
And
much.
also, we still have more stuff for Eden, before we conclude that report. Medi-Cal rates just went up. We have received an increase for Medi-Cal rates. Our old rates for room and board were $403.06, and for a bed hold was $394.13.
What was 394?
The room and board, the regular rooms, 403. So we got a whopping $14.45 per patient or $14.14 per patient.
What do you mean, per patient, per month?
Increase in our rate. So we went from 403 to 417 for a regular room and board. And then a bed hold, we went from 394.13 to 408.27. That's a difference of 14.45 or 14.14. So in my calculation, this is a retro back to January 1st of this year.
Oh,
We
wow.
will receive $59,000.
Oh, they're gonna make it retro.
Retro,
So then brings
great.
up the $1 million question of where are we with private pay?
Here we are. All right, so letters are about to go out. You have 2 letters that will go, one to the existing and one to the new patient. So anyone new coming in the board, remember we have to match that Medi-Cal rate.
Yeah.
So anyone coming in at a 2-bed daily rate will be $425. And then the single room, we only have 1 room in the whole facility now, which would be $455.
There's only one?
And even though those, so the state says it's retroactive, but we just have to start implementing it to the private now, right?
We're going to make this effective December 1st.
Okay. So the other thing is that I think as a courtesy to the private pay that we have, there's only 2.
There's one
Oh,
right
there's
there.
only 1 private pay?
She will receive a letter, her own
But
formal
what
letter.
I was going to say is, as a courtesy to the family, is to give them a phone call.
Oh, sure.
And, just say, and just explain to them. And then tell them that it will be followed up with a letter. But I think as a courtesy to them, it reinforces that small town personal care.
And remember, we have a letter for new and then existing. If you guys recall last year, you guys wanted to take it a little bit slower. So the existing price for a 2-bed will be $388, and the single bed will be $418. Where new people coming in will pay $455.
But again, just as a courtesy to the
Absolutely.
residents, don't want you to be surprised when you get the letter in the mail.
Yep.
Okay, thank you.
Yeah, and that's it.
Thank you, guys.
Thank you.
Thank you,
Good.
Natasha.
Thank you.
Okay,
Clinic. Okay, so we are well on our way for hiring a front office staff member, adding to the team. In just 2 days that we've had this position open, we've received 15 applications. We are also adding to our MA team. In just 7 days that that's been open, we have 29 applications. So a lot of new activity and interest in those 2 positions. I did want to share with you guys that we have some returning employees. Erica Leon, who was with us for about 15 years, is now come back to our medical records at Eden Valley. Mirta Pereira, she was an LVN, has now come back as an LVN. Matrice Myers, another LVN, has now come back as an LVN. And Barbara Wall also came back. We also have Pamela McCrum. She's also come back. Pamela Hernandez. If you guys remember, she was in our activities, Pam. She's now
Good.
She's now come back. She's
Everybody
actually.
left her, I'm glad.
Mhm.
Well,
Yes.
and she said that she needed a full-time activities director.
She's actually going to do social services for us. That's been her strength.
Oh, she was,
Very well liked, so I just wanted to share that with you guys as well.
Can I ask, can we ask where they went Did they all go to the same place and now they're all coming back?
No, I know where they went. They didn't, no, they all went to different places.
Oh, they did.
Yeah, they all went to different places, and for different reasons, you know, and they all say that they have grown and have developed, and they're bringing now that back to us, those experiences, yeah, so we're really happy about that as well. On the clinic side, like I mentioned, we have those 2 positions now open. Last but not least, let's see, let me go back to my agenda. Talked about that, performance evaluations. So performance evaluations is what we've been going through the last couple of months. Starting back in August is when we launched performance evaluations. Oh, pardon me. Let me go back to the clinic side before I jump to the performance evaluations. On the clinic side, we hosted the flu clinic, and we had over 158 individuals who came to our clinic, and that was at the Main Street Middle School. This was hosted along with the health department and Hartnell College and the Soledad Unified School District. So that went really well.
What was it?
It was a vaccine clinic
Vaccine.
for flu, so I wanted to make sure that I didn't neglect mentioning that.
Sophie, we're recording that on the master list? Yes.
Okay, moving along, so we've been really busy with evaluations. Hi Max, welcome.
Hello.
And so I wanted to give you guys a kind of a mock example of what they look like. This is last year, so a lot of some of the stuff is not current anymore, but just to give you guys an idea. So it just goes through, and gives like a summary to the employee. It tells them the year, it gives their name, their position, the date of hire. And if you start in the first column, it kind of goes through the history of their compensation with us, and this specifically looks at 2 years. It talks about the evaluation score. It then goes into the summary of adjustments, so it talks about base salaries, where their annual increase is at this year, their hourly rate, and their overall. And then the next column talks about their total benefit compensation, what we invest back in the employee. And it goes through the paid time off, the paid holiday, float is no longer one, health insurance, retirement, life, and AD&D. And then finally, it tells them what their total compensation is with the district. So that's kind of an idea of what we do with our staff. It starts in August. We start all of the rollout in August to the managers. They start doing their documentation and entering into the report in September. By this month, we do the actual increases. So just a little bit of background. There was 85% got above a 3.0 and 15% got below a 3.0. And to be eligible to receive a merit bonus increase, you have to have worked in this time frame. So it's usually our fiscal year, so July 1st through June 30th of this year, and at least work 6 months. Had to at least get a 3.0 or better, so that meeting your standards, and then had no corrective actions, and that makes you eligible. So that went really well in this fiscal year, so much appreciated they were to the board.
So, who does this?
We do.
I know, but when you say we, is it?
Human resource.
Huh?
Who does what part? I'm sorry.
Human resources, and then like the director of the...
Oh, each manager does their own evaluation. They meet one-on-one with their team members. They're the ones that write it.
Okay.
They present it. That's their, we help in this part. We help, human resource helps in this presentation.
That's what I wanted to know, is that...
They do the breakdown for each employee. the
Yes,
breakdown,
'cause
and
we
they
have-
present it with a copy of the report.
Yes,
Okay, so Natasha takes care of Eden Valley and.
Yeah.
Mhm.
Okay.
I think we have not us, I mean, the people who work here have to thank Ida for that, because I was asking earlier, and we never did this. We never gave bonuses. And so Ida came on and she instigated this program.
Yeah.
And so everybody who works here is involved in it and gets some
Good.
bonuses.
Yeah.
So
So-
they need to
And
thank
all
Ida.
150 employees.
Yeah.
So eligible wise was about 80 eligible this time around.
But for valuations, everybody.
Yeah. So I just wanted to share that with you so that you guys were aware what goes on every October. They just got their bonus and merit increases what's today? Yesterday. Yeah, their paycheck up yesterday. So much appreciative, lots of thank yous and
Approximately how much was that?
I'll tell you right now. So the breakdown is, it was roughly 257,031.
The pay raises or bonuses? Or
That
combined?
is a pay raise. The bonuses were 21,600.
So there was 250,000 in pay raise. Not the salary, but the raises.
Yeah, the salary. The salaries went up by $260,000 for the year, and there was $21,600 in bonuses given.
But it's,
Okay, got
but
it.
it is a pay raise.
Got it,
Yes, yes.
That's that. So you're right, Ann.
got it, okay, thank you. Good,
Okay.
good.
So I just wanted to share that with you
And
guys.
how many people qualified for the bonuses?
So there was
Percentage?
85.
Oh, wow, that's good. 85% of 150 employees. Wow,
Of the
that's pretty
pool.
good. They're happy, I think.
They should be, they should be.
I mean, obviously, you can always do more and do better. I get that, but I am really appreciative to the board and what we were able to give this year. I mean, the years before we were like 2%, 2.5%, but this year we were able to more than double it. So, hats off to everybody and managing our financials.
What was, maybe you said this and I missed it, what was the bonus percentage based on their salary? Say somebody, if somebody made 60,000, was it a percentage of that, or?
No, the merit increases are based on, or their increases are based on their 7-point scale and their grading. And their bonuses are based on their positions and their contributions back to the organization for the year.
Okay. So it's kind of arbitrary then?
A little bit. There's a little bit of that, but there's also performance. There's acknowledgements within the and positions. So you'll see a lot of it given at the levels like your providers,
Oh, yeah.
your directors.
Uh-huh.
But you also have some front office staff that have contributed, so they've got bonuses as well. We had one individual who we needed her to be in one department, and then we moved her to a second department and moved her to a third department.
Oh, gotcha.
Yeah, so you wanna reward that.
Yeah.
That support
Flexibility,
and that
yeah.
flexibility, yeah. Okay, so that's the performance evaluation strategic plan. So we want to get back on track. I know Graig has mentioned this. So as you guys recall, we built this beautiful strategic plan in 2021, and it was a 3-year projected plan that started in 22 that went to 2024. So I think our goal would be to have like we did last time, a special meeting in order to really conquer it and go through it all. And some areas of focus just to kind of, and I'm not going to go through this whole report, but just to kind of give you guys some thought process of what we looked at. Our strategic focus and approach was communication, efficiency, and standardization. How we would do that is fortifying infrastructure, maximizing capacity, and scaling. We also looked at strategic directions we would take, which is governance, strengthening our governance, maximizing our census and impact, improving our operational excellence, and raising our visibility, influence, and investment. So those are the things that we looked at as our priorities at that time. And so we'll make it a point where we would have a special meeting where you guys would all come in and we can start working through this again and getting all the updates. And LAFCO. So I just wanted to update everybody on LAFCO. They are in the process of getting their getting our MSR report completed. So if you guys recall, they added us, they actually got us ahead of schedule of the MSR report, and they have now begun that process. This is going to take some time, it won't happen overnight, but they did put it in their October 23rd meeting minutes that they will, they have begun the LAFCO background work that they need to do to start their own review of the MSR report for us. And how they wrote it was, this was on their LAFCO meeting minutes assigned October 23rd by Kate McKenna, the executive officer. And she said, an MSR and SOR study for Soledad area special district is getting underway. The study will focus on the Soledad Cemetery District challenges with transparency, accountability, and compliance with state and legal requirements. The Soledad Mission Recreation District, financial, operational, and governance challenges, and the Soledad Community Healthcare District, existing services and potential strategies to address financial challenges to maintain and expand the delivery of vital services to a growing community.
When we're dealing with LAFCO like that, can we do something about the being included as being anxious here? Can we at least enter that conversation with them?
Absolutely, that's around the time
Okay.
that we can do that. And I think that concludes my reports, if no questions.
Okay.
I got a question.
No.
Yep.
So, looking at this compensation report, I know we had, well, I'll put this way, it's, what about the retirement plan? Have we implemented it again?
That would be something for the board to decide of when they would want to reinitiate that.
Okay.
As you heard from Brent, yes, we're doing well, but we're not quite out of the woods yet.
We don't want to spend it down. That's what.
But I mean, it's entirely up to you guys on what you guys would like to do. Are we there? Have we done it yet? No. But you know, maybe we can consider, I know we have generously given about 3%. We can maybe consider doing, you know, less than, but that would be entirely up to you guys. But also keeping in mind that we're still trying to get back and get out of and increase our cash flows, and
Not ready.
so there's a lot of moving parts.
That's fine, and maybe we'll just, you know, revisit this again in November.
Okay.
And, you know, with your recommendation of, based on the financials.
Yep, and I can have Brent help us out with that as well. Okay.
So I have 1 to 2 questions, and I apologize. One thing on the financial report that I looked ahead of time, talking about the professional fees for these 3 months is over $1 million. And I was looking at the contract from the Trinidad, and if we paid them $1,800 a day times 8 hours times 5 days, that's about $36,000 a month. So that's about $108,000. There's another $900,000 in professional fees. Could we break that down?
Yeah, it's all the nursing staff that we have at Eden Valley because we grew our census. So remember, we went from an average of 30 to 59. And so the majority is being spent on the Eden Valley side. And that's, you're paying for LVNs and CNAs.
And that's professional fees, not salaries?
Mm-hmm.
Because they're tips?
Their agent, yeah.
That's my point, okay.
So Natasha in her report earlier today had mentioned to the board that that number is going down. There's a major effort to bring that down. And so you'll start seeing the improvements in that number.
So I asked before, something like this, any number more than $10,000, breaking that down, we could look at that, we could see things. When you say $1 million, it's okay, it's $1 million, what's next? And we have no idea or even making comparison.
Brent reported on that during his
Okay.
report, and he did kind of share with the board where all that was coming from.
Okay, I'll put a written request to get details next time. I do have one other thing on this. I think it's important for us to talk about because we are not a not-for-profit corporation, we're a government entity. And even in the contract with Natividad, it's listed as Soledad Community Healthcare District, a California nonprofit corporation, which is not what we are. And that's a mistake. And I bring it up because there's several times we use that word in our stuff, and we do not make profit, but we're not a nonprofit corporation. The rules are completely different for us than a nonprofit corporation. I think that's important for us to understand that, because there are different laws that apply to corporations that we're not.
Okay.
Okay. So we'll turn into closed session.